It's really wonderful to be with you from lockdown today, and thank you so much for joining in this session. Quickly give you a little overview of the Yoga Impact Charity, the organisation that I'm from. We provide evidence-based, trauma-informed yoga programs and trainings globally, and we've shared more than 1,500 evidence-based, trauma-informed yoga programs since 2015. And we don't just focus on refugees, but that's going to be my focus for this presentation. We also share programs with frontline healthcare workers in response to COVID, survivors of sexual and family violence, people in detention, Aboriginal carers, and the Special Forces through the Australian Defence Force. Some of our community partners include those listed on the slide. We partner with not-for-profits, government and schools, so that we're working with multidisciplinary teams when we're sharing yoga programs. I'm going to be focusing on an evaluation that was conducted in partnership with STARTS, and it was funded and supported by the Vasudhara Foundation. If we've got time, I'd also love to share a little bit about the methodology of the actual programs that we're sharing, so you can get a bit of a flavour for the colour of our approach, as well as the results and impact of our work. So we know that refugees are at risk of psychological complication due to high levels of cumulative trauma. And of these complications, we know that post-traumatic stress disorder and depression, as well as anxiety, are amongst the most common. We also know, thanks to Bessel van der Kolk's work, especially in the Body Keeps Score, that there's an increasing recognition of the importance of the brain and the body in the development and maintenance of trauma symptoms. And because of this, there's an increasing interest in mind-body therapies as a part of treatment for post-traumatic stress disorder. There's little previous research on the use of yoga with refugees, and that made it really difficult for us to explore programs with refugees, especially in 2015 when I was first doing this. We do know that there are lots of findings about the impact of yoga with trauma in other populations, and also beyond the psychological benefits, that there are also other benefits for trauma survivors who participate in yoga. So there might be improved general health, as well as improved sleep, improved resilience, and reduction in stress. The mechanism of effect is still being determined. Why does yoga work? Well, one of the main hypotheses is that the promotion of different breathing techniques in yoga class reduces hyperarousal by nervous system regulation. So one of the core differences between yoga and exercise is this focus on the breath, and really this focus of the mind and the body. And this is one of the key hypotheses for why yoga is having such a powerful effect on our physiology and psychology. Also, we know that there is evidence for increased psychological flexibility and also improved body awareness and tolerance of physical sensations. So we know that trauma survivors are often cut off from internal sensations in the body because they can feel really overwhelming and uncomfortable. And what are we doing when we're coming to yoga? We're making a bunch of uncomfortable shapes, and we're learning resources to connect with that discomfort, gradually improving our window of tolerance and hopefully being able to apply those skills from the yoga class into our daily lives. I should mention that not all yoga is created equally, and that there are different ways and approaches of sharing yoga, and I'll hopefully have the chance to speak with you about that after I've shared the results. So this all began with a pilot program. I taught a 2-month program and invited 5 organisations to be part of it back in 2015 with 64 refugee and asylum-seeking women. We just asked them to write one word about how they're feeling, and we measured their attendance, and off the back of that pilot, we to host a 1-year yoga program, offering weekly yoga classes, trauma-informed yoga classes to groups of refugees, and we did this in partnership with STARTS. Classes were held in Western and Southwestern Sydney. What's important to note is that each of these classes were tailored to the needs of the group according to the Yoga Impact Charity's trauma-informed methodology. So quite different potentially to what you're experiencing at a general yoga studio. And also there was an innovative program design in that it was bringing together a multidisciplinary team. So a trauma-informed yoga teacher with a psychologist or a counsellor and an interpreter all working together to hold a safe space. A little snapshot of the yoga groups from that program. You can see we were working with people from Bhutan, Iraq and Sri Lanka. And in terms of the aims, we were focusing on inspiring psychological and physiological calm through the different movement and breathing techniques that we're sharing, as well as physical relaxation in the body and an improved mind-body connection. We shared different smiley faces that people could drop in a box at the end of their session. Really happy, a little bit happy, medium, a little bit sad, very sad. And we also collected attendance ratings. We also shared a bunch of psychological questionnaires, including the Harvard Trauma Questionnaire, Part 4, so that we didn't re-traumatize anyone attending, the Hopkins Symptoms Checklists looking at depression, and the Freiburg Mindfulness Inventory. We also measured heart rate variability and had some fitness assessment. And people at STARTS also hosted focus groups where they explored the impact of the program with the participants and the counsellors that were involved. We collected data at 3 points in 2016, February, the middle of the year, June, July and October. Predominantly our participants were female, and I said before, from Iraq, Bhutan and Sri Lanka. Most of them have been in Australia for roughly 5 years, so they weren't newly arrived refugees or asylum seekers. We can see that initially people were super interested in classes and then it drops off a little bit. And, you know, lots of people, there's a lot of buzz about yoga and it's a bit trendy. Lots of people really curious to try, but then we find we get kind of a core group of regular attendees after the first few sessions. Our satisfaction ratings were really consistently excellent. We see it drop off kind of at the last session. We suspect that this is because we hadn't confirmed whether or not the program was continuing because we were waiting to see the evaluation results. So we suspect that some people were disappointed that the program had ended, and our focus group certainly confirmed that stream of thought. We did actually continue all of the classes for many years after this program. We saw a reduction in post-traumatic stress disorder symptoms as measured by the Harvard Trauma Questionnaire, such that yoga sessions predicted a reduction in post-traumatic stress disorder within 9 classes. And we saw similar results for depression. Within 12 classes, depression symptoms were being reduced, and that was over and above the effect of mindfulness. We saw qualitative findings from participants on a psychological, social and physical level. And we didn't see anything in relation to the heart rate variability and fitness assessment. So we concluded from this research that attending more yoga sessions predicts lower PTSD and depression symptoms, but that there's lots more work to be done in this area given that there's so little research. For anyone who's interested in learning more about this, I recently co-authored a paper that's been published in the International Journal of Yoga Therapy, which looks at best practice for organisations and yoga teachers looking to share yoga in a trauma-informed way with refugee populations. And then just very briefly, I just wanted to share that our approach is really quite unique to a studio, and I really want to make that point. So we're bringing together yoga, somatic therapy and psychology in what we're sharing. And we're also following some core trauma-informed principles with everything that we're sharing. And it's really important that anyone who's working in a trauma-informed space and sharing yoga is adopting a trauma-informed approach and is thinking about how to adapt to different diverse communities. It's really important that the communities that we're working with are also themselves, empowering their own communities. So we've established a 200-hour yoga teacher training certification, so that people who are interested in sharing self-regulation techniques and movement and breathing techniques with their communities are able to do that. It's an evidence-based, trauma-informed yoga training for diverse communities that launched in April this year. And by the end of the year, we'll have 40 teachers certified in this approach, and 5 of them are scholarship recipients from refugee communities. So in closing, I'd like to acknowledge the Vasudhara Foundation, who made all of this possible and supported me and the charity. I'd also like to acknowledge STARTS for doing the project evaluation and conducting these yoga programs in partnership. And I would now like to hand over to Jacinta.